My laboratory has this long-term interest in to understand how sex hormone play a role in breast cancer and prostate cancer. So one type of drug now has become very important to treat breast cancer, or so-called aromatase inhibitor. These are drugs actually suppress the production of estrogen in our body. But through that mechanism, actually we can treat breast cancer, which rely on hormone to grow. So in our research, then actually a lot of time to try to understand how these type of drugs work. And the one question we did ask is saying whether we can find the natural chemicals in what we eat in our diet actually has the ability to do that. So that's how we got into the research on mushroom. Through that efforts, we actually screened probably 7 to 8 different types of vegetable, and for its ability, their ability to suppress estrogen formation. So among them, mushroom turned out to be one of these vegetable actually has that ability to do that. So we start out to actually do the laboratory work to understand how it works, what are the chemicals involved, turned out to be some sort of fatty acid, and then we carry out the animal study to show the actual work in animals. And now we actually in the process treat in patient to test how it works. What we actually find in our laboratory then actually mushroom contain chemicals can actually suppress the estrogen formation. In both with so-called in vitro and vivo study, in vitro that's in the test tube in cell line, as well in animals through feeding experiment we can achieve that purpose. So therefore then potentially it is possible through feeding or dietary intervention we can actually reduce the estrogen level, especially so-called in postmenopausal women. That will be protective against this type of breast cancer. We always know that then by having fruit and vegetable can help us, fighting against various different type of disease. However, then a lot of time we don't really know how they work. So what we can say here then actually in mushroom we do find such chemical can reduce estrogen formation. So at least we have so-called mechanism-based type of finding, so we actually know for work. So what we try to suggest that then we actually should consider including mushroom in our diet potentially can protect us. But obviously we do not recommend overeating them. From our mushroom study at this point, then we have learned several things. For one thing, then through its ability to suppress estrogen formation without then actually maybe protective against breast cancer, especially those type of rely on hormone estrogen to grow. So that's mostly happened in postmenopausal women. And on the other hand, then we also learned that then potentially these chemicals in mushroom can also help men to reduce the effect of the androgen, the male hormone. So therefore, maybe potentially will be very beneficial for men to fight against for prostate cancer. And the third area of finding, then we actually found out that actually the mushroom intake somehow can actually reduce the lipid accumulation in the liver. So in other words, also lower incidence so-called fatty liver. That obviously an important point that's saying, we always say that the dietary intervention is not a process to cure cancer. Rather than reduce the incidence of the cancer, therefore maybe prevention or delay the onset of a cancer, but never really to taking the diet actually as a way to cure cancer, because certainly the quantity in these diet in, for example, mushroom, not high enough really to treat the cancer. And also then I think the other important point that saying when patient has the disease, they need to work with their doctor. They cannot act as a doctor themselves, decide changing their, the drug or the diet, whatever. So it is very important to keep that in mind. So again, the dietary intervention is really for prevention, not for treatment.